Hi, Oscar here, the simple surgeon. I am such a simple surgeon, I cannot even count properly. I said this will be a sixth video series, and here I am for the seventh time in a row in the EBM or evidence-based medicine series, talking about evidence-based medicine's variations, guidelines, and dangers of using and misusing evidence-based medicine. This episode will be on a forgotten by me, very important part of practicing medicine, which is evade-litigation based medicine. This will be another E to add to our collection, apart from evidence, eminence, experience, and episode-based medicine, evade litigation-based medicine. Litigation nowadays is an intrinsic part of practicing medicine in any form or shape. It's here, and in the foreseeable future, it's not going anywhere. So we just need to deal with it. Many say that prevention is the best cure, and litigation is not a pleasant process. Being litigated, being sued for something, whether it only be a civil case or sometimes even a criminal case, is not pleasant at all. As a matter of fact, it can be the most distressing event in your career. Yet the statistics say each doctor will need to face litigation at least once in his or her career. Therefore, a lot of people will bet on prevention. But prevention has its consequences, and the consequence is practicing defensive medicine. The consequence of evade litigation based medicine is defensive medicine. How does it look? People would order a lot of unnecessary tests just because somebody, somewhere, sometime has sued another doctor for not performing a test in similar or near similar situation. If you are a patient and your doctor orders a battery of tests, some of them may be coming from the EBM defensive medicine, evade litigation. Is it all bad? Maybe it isn't. It asks for attention, focus, and due diligence from a doctor. But a lot of the time it is excessive, unnecessary, or sometimes even harming. The consequences of unnecessary tests can be mild or severe. It can all be financial ones, or it can actually give harm to health. I'm going to put my fist on the table, not forceful because it doesn't sound good. I am against defensive medicine, strongly against. I think it does more harm than good. The idea is, if you are practicing a defensive medicine, so doing everything you can not to get sued, you will eventually miss something anywhere. It won't help you, but your level of focus, attention is going down, it's diminishing. Don't be fooled by false confidence of the defensive medicine. It is false. To put it more like a picture, if you try to cover your hindsight all the time, whatever you cover it with will eventually bite you in the hindsight. Whatever you covered with will eventually bite you in the hindsight. Let me give you an example. Once the computed tomography, the CT or CAT scans, become widely available, people with head injuries would start to sue their doctors or their families sometimes for not performing a CAT scan. Remember, when it started, it was expensive and not available in every place. They would start to sue people, sue doctors for not ordering a CAT scan, or the hospital for not performing a CAT scan in every head injury. And consequences of paying high reimbursements, high fees for the lawyers to the hospitals resulted in CAT scan being more and more often used, even for minor head injuries, and eventually it actually went into the guidelines to do a CAT scan in nearly every head injury. So many conditions were in the guidelines that you should consider doing your CAT scan. And if you don't, you'll be sued. And if you do, well, it's in the guidelines, so you're safe. Are you? No, you're not. As it happens, CT scan or CAT scan is not neutral to health. It's an enormous dose of radiation. The X-ray, it is equal to 50 to 70 X-rays or chest X-rays taken in a few seconds and through the very delicate tissue of the brain. It is not neutral. It can be harming. And after 20 or 30 years of using CAT scan for head injuries, it becomes apparent that it can cause neoplasms from all the radiation going in, and the actual rate of the neoplasms caused by one CT scan of the head was calculated at 1 in 2000, and some researchers even say 1 in 500. So 1 in 500 CAT scans can cause a lethal neoplasm, malignant neoplasm that can kill you or will kill you, and is happening just because of this CAT scan. Now, this is a mathematical calculation. Nobody will be able to prove that this particular CAT scan caused this particular cancer. But they will sue you nonetheless, and they will win. Therefore, nowadays, the conditions in which you should perform a CAT scan in head injury are reducing. But this is nothing to do with evidence. It's all evade-litigation-based medicine. Now, the evidence is emerging when to do the CAT scan, when not to do the CAT scan. And I will have a separate series on trauma and head injuries, so this is not the place to cover it. But as you can see, this can change the evade-litigation based medicine can change the thinking of the whole medical community and empower people to use unchecked guidelines based on litigation, not evidence, to do good in purpose, but to do harm in reality. That's why I am against defensive medicine, because we don't know what are the long-term consequences of over-testing our patients. And I'm not saying only about invasive tests like CAT scan, when we know there is a harmful radiation going into the patient's body, but also over-testing the blood results and making other decisions based on blood results, like starting, let's say, lowering cholesterol therapy, while we would never know about it. in kids? What are the long-term consequences of using statins from the early age? We don't know. Be careful. If I am against defensive medicine, what do I use instead to evade litigation? I don't want to get sued either. And if I am, I would like to be able to defend myself. And the thing that is there from way before to prevent you from being sued is due diligence. Due diligence, it is so important. I have a habit. It is sometimes an annoying habit. It is sometimes poorly understood habit, if people see me doing it. But whenever I receive a phone call from the emergency department asking for a pediatric surgery consultation, doesn't matter, it's head injury or any other, I go down and examine the patient. Unless obviously I can immediately decide the patient is coming in for an inpatient treatment, and I will examine him in a minute. But I never give recommendation to discharge a patient without examining. This is my filter. This is my due diligence. I never base myself on somebody else's examination. I examine the patient and then give recommendation. Most of the time, it would be obvious that a decent examination has been performed by the referring doctor and is well referred, and I could have made a decision of discharge and follow-up on the phone, but I don't do it. This is a part of my due diligence. Every patient I send home has been examined by me. First point, examine the patient. It is a due diligence. Second point of due diligence that I use, I always, as long as it is possible, make contemporary notes on the case. Whenever I have been asked for a consultation, I go and examine the patient and then write a note. And I am a surgeon. I don't write lengthy notes. I just write whatever is needed. So in 5 years' time, I can reevaluate. I can follow the thought process I had at the time and defend myself in the court of law. Why 5 years, you will ask? Because the research says this is an average time you will receive your letter from the other sides or from the patient's lawyers. 5 years down the line, you won't remember a thing unless there's a note done by yourself that you can read and follow your own thought process that took place on that day. And then you will be able to defend yourself in litigation. Due diligence. Obviously, know your guidelines, have the medical knowledge, follow the medical knowledge. But due diligence is much more than that. These are strong habits. So, another example. So I get a phone call from the ER department, and the doctor says, "Look, this kid is well. It's 6 hours after the head injury. No loss of consciousness, no vomiting." Playing around, behaving well, neurological examination is fine. What would you like me to do? Can I send him home? I said, of course you can, but once you have rang me, I'm going to come down, examine, and co-sign that discharge. That's my due diligence. And what is yours? If you have any other thoughts or ideas, write them down under this video. Thank you very much for your attention today. This is the 7th out of the 6th series of evidence-based medicine, and I am doing another video shortly This will be a questions and answers session. Actually, one question came in, but it's a big one and deserves a separate video. And the next video will be on how to read medical research. The question was asked by Shimon. Thank you very much for that question, and especially for Shimon and everybody else interested. I will record that next video, number 8 out of 6 in the EBM series. Thanks. Bye.